Hello, my name is Erin Dean. I am a Bethel College nursing student, and today my presentation is called School Nurse Screenings Impact on Homelessness. So, on a personal note, what kind of drew my interest into this is I have a brother who suffers from both mental illness and substance abuse, and I've always kind of wondered from a young age who could have been that middleman to kind of change the trajectory of his story. Homelessness is not new here in America. We all know this. There are so many different reasons, right? Substance abuse, mental illness, poverty, unemployment, lack of affordable housing. But in this presentation, I really want to focus on mental illness and substance abuse. Um, so there are factors that make somebody higher risk than the normal person, right? So that can be having direct contact, like somebody in your family who suffers from mental illness or substance abuse, um, a person experiencing poverty, or just early exposure, like friends in high school, right? But the question lies in, even though there's all these preventative measures like community programs, programs implemented into our education systems, why does homelessness continue to grow? Well, the thing about it is, just as people are able to receive these services, they're just as able to decline these services because they're not mandatory. So I really want to get started here just with some background information on information that really just kind of piqued my interest just right at the beginning of when I started doing my research. So I'll start with this. In 1991, the Universal Declaration of Human Rights deemed housing as a basic right. However, to this day, homelessness within America still continues to rise. In fact, out of the 300 million people that live here in America, 600,000 are considered to be homeless. And of the 600,000, 20% of that number are considered to be children, some of which are still students. The irony in this is public schools have funding that provides programs for these children who could be facing these issues. However, it was proven that these programs are insufficient until recently. In 2018, the Federal Commission on School Safety was created in order to review and establish best practices and safety efforts within schools. The idea was that faculty within the school would be trained on how to kind of red flag or identify children who were having major issues in their lives, and then be able to implement programs that would help kind of redirect that child and help them push through these issues. This meant that faculty had to be extremely aware of what was going on in each student's lives, and also that school nurses had to be extremely thorough with both assessments and screenings. The goal was kind of to create a more violent-free or safer environment for children to be able to flourish and succeed both now and within their futures, right? From any issues, which, like, for example, mental illness and substance abuse, right? Considering that, well, which brings me to my next point. Okay, 50% of the homeless population suffer from either mental illness, substance abuse, or both. And being a nursing student and taking one of our core classes, which was mental health, this number to me was astonishing, because one of the things that you learn in that class is that a lot of many mental illnesses and substance abuse issues can be detected within adolescence. So from the age of like 14 to 18, there's so many years and so many chances to try to detect this and then implement treatment. But that only works if the faculty has proper training to identify these things. So next, what is the role that the school nurse could potentially play in this topic, right? In a study performed specifically to determine the effects that school nurses have on children, it was discovered that school nurses who take part in every level of school health services can play an important role in the assessment and management of health risks of students, and in having students adopt healthy life behaviors, and that many nursing practices have a a positive impact on both attendance rates and overall education performance. So, with all that being said, my research PICO question is, in high school age adolescents between the ages of 14 through 18, how do mental illness and substance abuse screenings done by school nurses affect homeless rates compared to adolescents that don't receive these screenings? So, for my CUSIN competency, and for those of you that don't know, CUSIN stands for Quality and Safety Education for Nurses. This was kind of created for future nurses and active nurses to be able to implement better quality of life and safety practices within healthcare systems. There are 6 competencies, but for mine, I chose 2, which are evidence-based practice and quality improvement. So CUSIN defines evidence-based practice as integrating best current evidence with clinical expertise and patient family preferences and values for delivery of optimal healthcare. So in regards to school nurses and their ability to screen children for mental illness and substance abuse, this definition plays a huge role. Screenings are a good aid in detecting any potential health risks, especially in children who tend not to seek help. This is because most screenings are either done on paper or they're done on some type of online database, which takes the pressure off of the child feeling like they have to defend themselves or defend their family from an adult who they feel is trying to intrude. Screenings also come with guidelines so that nurses can ask more specific questions as well as pinpoint more specific nursing diagnoses. Because as I've mentioned before, if they are properly trained to be able to detect these things, then the earlier treatment can be implemented. So for quality improvement, CUSIN defines this as use of data to monitor the outcomes of care processes and use improvement methods to design and test changes to continuously improve the quality and safety of healthcare systems. So in regards to school nurses, it is their job and the faculty's job to come together and make a judgment on what they think is going to help improve a student's life and also help them to succeed. Many times this will result in implementing different programs that the child can attend during the school day. Doing this allows for the faculty to have more control over the progress that the child is making, how many times they attend the program, and then also implementing any potential changes that need to be made to add to that child's success. So next, I want to talk about some studies that really bring this topic together. So to start off, I'm going to talk about a study that was conducted in South Carolina. The purpose of this was determining the benefits, limitations, the barriers to implementation, and feasibility of behavioral and mental health screenings. During the study, it was discovered that 1 in 5 children met the criteria of having a mental disorder, but had not received any source of treatment. And in a similar study to that, nurses concluded that treatment plans only worked for children who were in a controlled facility long-term, because this made it easier for the faculty to be able to control how this child's day went, which created for a more successful environment. In another study, it was believed that because most homeless people are above the age of 50, that the baby boomer generation and the certain illnesses that they had to deal with had a major effect on why the homeless population is the way that it is. This point really couldn't be proven, but what was proven was that this homeless population had to deal with much more current vulnerabilities. And to explain on that, when I say vulnerabilities, I mean functional impairments, untreated mental illnesses, substance abuse. And within that, within the study, interviewing each participant, it was discovered that all of them that had a mental illness or substance abuse were well aware that they had this issue from early on as adolescents to middle school. However, they never received any treatment, which to answer that question in a similar study, it was stated that in regards to behavioral and mental illness, that left untreated, behavioral and emotional concerns are most likely to persist into adulthood and to require more intensive services, which gives insight into why 50% of our homeless population is either dealing with mental illness or substance abuse. So lastly, in the last study I want to mention, this was done in Jacksonville, Florida. It was conducted on children who were already considered to be homeless and living in a shelter. The goal here was that the study was to screen children for mental illness, set up referrals if needed, and then facilitate the follow-up care that they might need. The idea was to see if having more control over these factors would lead the children into getting necessary treatment. So out of the 476 children that were in the shelter, 118 met the criteria to be screened for mental illness. And out of the 118 that required that were screened, 50 required further assessment. And then out of those 50, 25 of those are still in treatment to this day because of all the steps leading up to that, which is a huge deal considering that 50% of our population is mental illness and our homeless population, excuse me, is either has substance abuse or mental illness. Half of that group is still pretty amazing. And in another study similar to this, it was found that undiagnosed and children who have been undiagnosed but untreated with a mental illness is usually due to lack of services, lack of transportation, and lack of finances. So just imagine what we could do for children if we were able to provide just these small things. So all in all these articles hold a lot of importance in the basis of determining that undetected and untreated mental illness and substance abuse can lead to homelessness. Although this doesn't answer the question for all of the homeless related issues, this does kind of give us an idea of the preventative measures that we can take to kind of help high risk children change the trajectory in their life. So in conclusion, school nurses are going to be one of our best candidates in early detection and early treatment for these children to be able to succeed. They are going to be our first line of defense because we are trained to pick up on abnormalities and suspectful trends that we think, this needs to be further searched into. And then lastly, as we all know, the earlier a problem is detected and treated, the better the outcome is going to be. So for recommendations, I believe that in order to decrease homelessness within America, because 50% of our homeless population suffers from either mental illness or substance abuse, screenings for at-risk children need to be done before the child enters into adulthood. Thank you.